There's a growing crisis in Medicare that almost nobody's talking about, and it could directly impact your ability to see a doctor when you need one. More physicians across the country are limiting how many Medicare patients they'll accept or dropping Medicare altogether. And if you will understand why this is happening and what it means for you, you could find yourself struggling to find care. So let me explain what's going on, why it's happening, and most importantly, what you need to know to protect your access to healthcare. So the root of this problem comes down to reimbursement rates. Medicare pays doctors significantly less than private insurance does for the same services. According to recent data, Medicare pays physicians approximately 26% less than private insurance on average for the same services. And here's the thing, Medicare reimbursement rates haven't kept pace with the rising costs of running a practice. While rent, supplies, staff wages, and everything else has gone up, Medicare payments have stayed relatively flat, or they've grown very slowly. In fact, Medicare physician rates have declined by 29% since 2001 when adjusted for inflation, even as practice costs have continued to rise. So doctors are facing a tough business decision. Either limit the number of Medicare patients they see, or risk not being able to keep their doors open. Now, there are different ways doctors can limit their Medicare participation, and it's important you understand the difference. Some doctors stay in the Medicare program, but simply limit how many new Medicare patients they'll accept. They might continue seeing their existing Medicare patients, but they're not taking on new ones. This is becoming increasingly common, especially in certain specialties like dermatology, orthopedics, and psychiatry. Other doctors go a step further and formally opt out of Medicare entirely. When a doctor opts out, they enter into what's called a private contract with their patient. This means they don't bill Medicare at all. You pay the full cost out of pocket, and Medicare won't reimburse you for any of it, not even the Medicare approved amount. If you see an opted out doctor, you're responsible for 100% of the bill, and it can be expensive. This problem hits even harder in rural areas. Rural communities were already struggling with doctor shortages before this trend accelerated. Studies show that rural areas have about 30% fewer primary care physicians per capita compared to urban areas. Now, when the few doctors in these areas start limiting Medicare patients, it creates what we call healthcare desert. Places where Medicare beneficiaries have to drive an hour or more just to see a primary care doctor. I've talked to people who have had to drive 2 or 3 hours for a specialist appointment, sometimes even out of state, because there's nobody closer who will take their Medicare coverage. And that's not just inconvenient, it's dangerous. When you're dealing with serious health conditions, distance becomes a real barrier to getting timely care. Here's something really important to understand. This issue affects Original Medicare and Medicare Advantage differently. With Original Medicare, you're directly impacted by these opt-out decisions because if a doctor doesn't participate in Medicare, you either can't see them or you're paying everything out of pocket through that private contract. Medicare Advantage plans work differently because they contract directly with providers through networks. However, Medicare Advantage plans are also dealing with network issues in some areas. And if doctors are dropping out of Medicare entirely, they're usually not on Medicare Advantage networks either. And if doctors are selectively limiting Medicare patients, Medicare Advantage plans may struggle to maintain adequate networks, especially in rural or underserved areas. So this isn't just an Original Medicare problem, it's affecting the entire Medicare system. So here's what you need to know to protect yourself. First, before you schedule an appointment with a new doctor, always ask, do you accept Medicare? And if they say yes, ask a follow-up. Are you accepting new Medicare patients? Those are 2 different questions. Second, if a doctor presents you with a private option, and because they've opted out of Medicare, don't just take it on the spot. Think about it carefully and understand exactly how much you're going to pay. You're giving up your Medicare coverage for that doctor's services, and you need to know what that will cost you. Third, if you're having trouble finding doctors who accept Medicare in your area, I strongly recommend contacting your state health insurance assistant program or SHIP. They're a free resource that can help you navigate these issues and find providers. You can find your local SHIP by calling 1-800-MEDICARE. Fourth, this is another reason why reviewing your coverage during the annual enrollment period is so important. If you're in a Medicare Advantage plan and your network is shrinking, or if you're on Original Medicare and struggling to find doctors, it might be time to explore your options and see if a different type of coverage would give you better access in your area. I want to be clear about something. Doctors aren't the villains here. Most physicians went into medicine to help people, not to turn patients away. But they're caught in a system where the math doesn't work anymore. When you're getting reimbursed at rates that don't cover your costs, you have to make a difficult choice. At the same time, Medicare beneficiaries shouldn't have to bear the burden of a broken reimbursement system. You paid into Medicare your entire working life, and you deserve access to quality health care. This is a systemic problem that needs a systemic solution. But until those changes happen at the policy level, you need to be informed and proactive about protecting your own access to care. This trend is only growing. Certain specialties are seeing particularly high rates of physicians who won't accept new Medicare patients. Psychiatry has been especially impacted, with studies showing acceptance rates significantly lower than other specialties. Dermatology and orthopedics are also seeing growing opt-out trends. So if you're planning to age in a rural area, or if you have complex health needs that require specialists, this is something you need to factor in to your long-term retirement planning. The bottom line is this: access to care is just as important as the coverage itself. If you have questions about your Medicare options, or if you're struggling to find providers in your area and want to explore whether a different plan might help, I'm here to help. I'm Callie Navrides, a licensed insurance broker and founder of NaviQuote. You can call me directly or schedule an appointment, and I'll help you review your Medicare options and find coverage that actually works for where you live and the doctors that you need to see. My information is in the description below. And if you've experienced this issue, if you've had trouble finding a doctor who accepts Medicare, leave a comment down below and tell me about it. I read every comment, and your experience helps me create content that addresses the real problems that people on Medicare are facing. And if you found this helpful, please like the video and subscribe to the channel. And after that, click right over here for more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.